right. Thank you all for being here for our Thursday vaccine media availability. It's more of a COVID-19 in general availability today. We're switching it up a little bit on the docket today. We'll have James English, our COVID-19 operations sector chief, give a brief update, and then we will be discussing the recently confirmed South African variant of COVID-19. We have Dr. Mark Pandori on from the Nevada State Public Health Lab and our epidemiology program manager at the Washoe County Health District, Heather Kerwin. And then we'll do Q&A after. James English, if you are on right now, if you could go ahead and give us a quick COVID-19 update, then we'll go to Dr. Pandori for some brief remarks and then to Heather, and then we'll do some Q&A. So James, if you're ready, please go ahead. Looks like James is having some issues logging in. Looks like. Oh, there he is.
Am I there now?
There you go.
Quickly, just want to give a quick update on the governor's comments yesterday. Washoe County as a region has their federal pharmacy partners doing age 65 and above. They got a large increase in vaccine in the upcoming week and can go ahead and move down into that group. Washoe County in general still does not have enough vaccine to get into that group in earnest. Renown Regional Hospital and Community Health Alliance have been approved to move into those groups too by our incident management team, along with Incline Community Hospital and North Lake Tahoe Fire Protection District. Furthermore, the health district and the incident management team have opened up all the different groups inside frontline community support to begin scheduling. So we are asking all employers to go ahead and make sure they're looking for those links and they're getting it to both their employees and their contractors that work under them. Additionally, we are not seeing an increase in vaccine next week because as part of community frontline support, you move into continuity governance, and the state legislatures and some of LCB are being vaccinated next week. With that, the allotment was taken off the state's overall allotment, and therefore the county did not see an increase next week. We continue to scramble with all available second doses to ensure that all second dose pods can take place this week. There are a couple that may have to be canceled over the weekend, but we are hoping to see our Moderna shipment show up. And with that, I'll turn it back over to Scott.
All right, thanks, James. We'll now head over to Dr. Mark Pandori to give a brief update on the recent confirmation of the COVID-19 variant. And I'm going to post the press releases from both the Health District and the Nevada State Public Health Lab in the chat regarding this issue. So Mark, Dr. Pandori, if you're ready, please go ahead.
Sure. Good morning, everybody. This is Mark Pandori with the Nevada State Public Health Lab. And I wanted to give an update on our variant searching program, which we're carrying out, our genomic surveillance program, as it might be called, at the Nevada State Public Health Lab here at the UNR School of Medicine campus. Over the weekend, a sequence was analyzed at the laboratory, which was found to be a member of the viral lineage B1351, also colloquially known as the South African variant. This sequence was confirmed. The details of the patient or any of that I won't give. I'll just talk about the actual finding itself from the laboratory perspective, but I think Heather Kerwin can talk to you about some of the rest. The specimen sequence that we generated from the specimen was submitted to what is becoming a standard algorithm and database for the assessment of lineages called Pango Lineages. And when this sequence was submitted to the database, it came back unambiguously as a B1351 or South African variant. We went ahead and resequenced this to be sure. That was part of the reason why it took a few days to confirm this, because we also didn't get the entire sequence of the virus, which is a very common phenomenology when you're sequencing. These specimens have varying degrees of quality. But when we went in and manually looked at the sequences and we resequenced the virus, we were able to ascertain that for all of the virus sequence that we achieved, it matched B1351 very, very well, if not perfectly, at the sequence that we were able to obtain. And considering that B1351, the South African variant, was there with regard to sequence data, and it matched what was to some degree epidemiologic data, it was easy to conclude that this was in fact the first case of B1351 in the state of Nevada that was located and detected by our daily sequencing program. I'm happy to try and answer any questions that you might have. Thank you.
Thanks, Dr. Pandori. We'll go to Heather Kerwin, who's the Epidemiology Program Manager for the Washoe County Health District, to give a brief update, and then we'll go to Q&A. Heather, if you're ready, please go ahead.
Sure. Thank you, Scott. Can you hear me?
Yes, we can.
Okay. This case did have travel history to South Africa, and they were, as required by CDC, tested prior to departure. They did not fly while infectious. So that's the good news there. Any of the contacts that were generated here locally have been identified and notified, and we do not have any further spread that we're aware of. There's a few that are still in the incubation period. We are asking that anyone who is a contact to variant of concern do stay in quarantine for the full 14 days. This is in alignment with what is being done for any contacts who may have been in contact with someone with a variant of concern across the state of Nevada. So we're just, exercising caution, especially for those who have traveled internationally, and maintaining that full quarantine period after you arrive to the U.S. We have been experiencing some challenges just in general with people being honest and open with us when we do our contact tracing. And I think this is a good example to just reinforce that data are confidential. When we do call cases, it's really important for us to have an open and honest dialogue so that we are able to efficiently contact trace and do our job and keep variants and other non-variants that are not of concern from spreading in this community. And then again, just reinforcing that getting vaccinated is still going to prevent infection. And even if you are infected, we're seeing it really reducing severity. So although there have been some studies that indicate that the vaccines that are available here in the US may not have that high protection rate that they were showing against kind of the general variants that are circulating, specifically against some of these variants of concern, but it's still important to continue to go forth with our vaccination efforts, because it will absolutely offer some protection, and that there's more studies being conducted to determine exactly how protective our current vaccines are against these variants of concern, such as the South African variant.
Okay, thank you very much for that update, Heather. Now we'll open it up to Q&A for media, so please go ahead and just feel free to shout out your answer or your question. If you want to leave your question in the chat box, I can also read it out loud to the group. So if you guys are ready, please go ahead.
Hey, Scott, it's Bob Conrad. I know we've covered this before, but we're getting hit with questions as to why some people are allowed to get the vaccine currently who, may be in an employment situation that allows them that. So why are, let's say, seniors still not able to get vaccinated? And I know the issue, but I'm hoping that somebody can speak to it on the record. Thank you.
James, you want to take that one?
Sure. This is James English. There are two distinct lanes inside the state's playbook that the health district has had to adopt along with our regional response team. That has created the essential workforce tier based on exposures, and also the general population tier. We are doing the best here we can at the health district to run seniors through all of last week and this week, reaching out in person, all sorts of media, all the employment groups and other groups that work with seniors to try to get them vaccinated. Furthermore, Sparks Fire has started vaccinating seniors along with a couple other community-wide open pods. And Renown is also increasing their senior capacity next week and have started this week. So the availability is there. If there are seniors that cannot get an appointment, they just need to reach out to our call center, and we'll do the best we can to direct them to where vaccine's available for them.
Thank you. So just to be clear, it could be some of these community-wide pods that are, allowing other folks in potentially.
Potentially, we have received quite a few complaints regarding how the federal partnerships with the pharmacies are operating. Some of them had gone into the essential workforce tier. We believe that's been corrected. They were supposed to stay in the general population tier and in the population lanes. So that should be corrected now. If we receive any complaints related to that, they are referred to the state and the governing boards, whether it's a pharmacy or medical facility, to look into those and ensure that only the proper people are being vaccinated to ensure equity. And there was science behind how they wanted the vaccine deployed based on risk or exposure risk. So we need to try to stick to that as best as possible.
Thank you. That totally helps. I appreciate it. Thanks.
Can you guys hear me?
Yes, we can hear you.
Hi, this is Cynthia from KTVN. I was just wondering if the patient with the South African variant, if they weren't infectious while traveling, I guess, did they catch it here? Or, sorry if that's a silly question, but I'm just, I guess, kind of confused as to how it came here if they weren't infectious when they were traveling.
Heather, you want to take that one? Heather is a very busy employee at the health district, so she might be on a call. Oh, no, there she is.
I was muted. I can take that one. Sure. So the incubation period for SARS-CoV-2 is estimated to be between 2 and 14 days, meaning from the time of an exposure, it can take anywhere between 2 to 14 days to experience symptoms as a result to that exposure. We do know that about 90 to 95% of cases that are sequenced in South Africa are being shown to be this variant of concern. And with this person's travel history, they spent their incubation period in South Africa, and there could be a small chance that they caught it while flying. But the time at which they became symptomatic was more than 2 days after they deplaned. So you're contagious 2 days prior to your symptom onset, and that put them outside of the plane travel, if that makes sense. Did that answer your question?
Yes, sorry, I was typing.
Oh, okay.
Yeah, hi Heather. This is Jason from the Gazette Journal. Like, as far as contact tracing, like, how did that go? Were they like? I know you mentioned that some people were sometimes hesitant as far as cooperating. Were they pretty cooperative? And how confident are you as far as like the contact tracing you did in terms of like not having any further cases?
So with everybody that we do our investigations with, we are reliant on the information that they provide us. This particular case was, very cooperative. We've had many others who are not cooperative. So had that been how this went, we could not say with any certainty that we knew who was a contact. They had, this particular case had just a few days where they had been around others and they could track where they were through those days. And, you know, it's sometimes the instances that someone is trying to be cooperative, but they just can't fully remember where they went while they were infectious, which is another barrier that we run into. But this particular case was very cooperative.
Thank you.
Any other questions for Dr. Pandori, Heather Kerwin, or James English?
I was just hoping to get some clarification on what you meant, Mr. English, on the scrambling to get second dose pods. Can you just clarify what you meant by that?
So as you've heard in the national media and possibly in our local media, along with from Governor Sisolak, the Moderna shipments have yet to arrive in this community. They were supposed to have arrived no later than Tuesday. Most days they arrive on Monday, but because of where they're being shipped from the East Coast and the Eastern United States, they were not able to make it out due to those large storms. Therefore, there were 2,110 second dose vaccinations that were scheduled for this week to use Moderna vaccine. We are working with all our regional partners to move vaccine around best we can to ensure the second doses can be administered. For example, the health district switched vaccine types for last night and went to Pfizer instead of Moderna to free up about 800 doses. We furthermore switched out another pod to relieve some more. Renown has helped assist in providing vaccine for some second doses, but there are a couple of clinics this weekend. We have heard we may get vaccine on Saturday, but it hasn't been confirmed, and those clinics would be able to run. Otherwise, we're looking to see what's still left in the community to provide to those providers to ensure those second dose clinics can take place as scheduled. Otherwise, as you can well imagine, you have to coordinate with both the providers and the individuals being vaccinated to ensure that they can be rescheduled and get it as soon as possible. So no Moderna came into this region this week, which was supposed to be the largest shipment to Washoe County was the Moderna vaccine, and it was going to be our highest 1 week shipment. So we didn't get any first dose Moderna or any second dose Moderna due to the storms.
Gotcha. So you guys are just moving some things around to be able to make sure that those who were scheduled this week to get their second dose are still able to get it in a timely manner.
Exactly, but it still looks like we may be a few hundred doses short because obviously we can't have doses sitting around. So almost all the first doses have been utilized. And second doses, there are some extras, like you've heard me say before. We've released all those. We did have a second dose clinic we're filling, and then we're going to see what's left over for this weekend in the hopes that vaccine will fly in here Friday or Saturday morning. We've actually been asked to be available to accept deliveries on Saturday for the region because of this issue. We were lucky. We requested our visor to come on the holidays since we were vaccinating on Monday, and we did actually get that. About half the visor across the country was able to make it to its destination this week. Otherwise, there would have been many more pods canceled in this community.
Thank you.
Hi guys, this is Jason again from the Gazette Journal. For Dr. Pandori, and I think Wednesday, Dr. Rochelle Walensky from the CDC expressed concern about variants potentially affecting the progress we've seen so far in terms of like lower case counts and deaths and hospitalizations. Do you have similar concerns, and what like advice do you have in terms of like ensuring that we don't see something like that here?
Yeah, I would say concern is the right word to use from my perspective, from a virologist perspective. Worry wouldn't be the word, but concern certainly would be. What we're seeing here with, let's say, the UK variant is a virus that has the ability to spread more readily, and we have data to support that. With regard to the so-called South African variant, the data that we have shows that it can do another trick, so to speak, and that is to some degree avoid immunity, not completely. But what both of those things are a product of the virus evolving. And the virus evolves just by replicating and jumping from person to person over time. So my concern stems from that process, that as long as that process continues to happen, even at a very low level in the population, it's giving the virus an opportunity to learn these so-called tricks. And so if when you talk about mask wearing and you talk about social distancing, and we think about those things in terms of public health and medical protective efforts to make sure that those most vulnerable amongst us don't get the virus, we can actually raise up to the satellite level view of this virus and say there's a whole nother virologic and evolutionary reason to do everything we can to keep this virus down, because if we allow variants to come out and then those variants to variate and change on themselves, we are going to, potentially be in a situation where we're facing a whole new foe, and we don't want to be in that position. So that's my primary concern. Thanks for the question.
Thank you.
This is Cynthia again from KTVN. I think it was last week or earlier this week, Dr. Fauci had said that COVID is or might be an endemic, which correct me if I'm wrong, but I think that just means like it's kind of like the flu, like where it won't go away, essentially. Yeah. So what are your comments on that?
There's every reason to believe that Dr. Fauci is correct in that statement, and that if you look at flu, for example, we would call flu that endemic, established, so to speak. Flu is something that public health and medical experts worry about on an annual basis, and we've trained to prepare for this. We change our vaccines every year. We adapt the vaccines every year to it because it's endemic, and we have so much experience doing battle with it. With this virus, it seems to be more infectious than influenza even. So there's, for that reason, every reason to believe that getting this down to total elimination is going to be very, very, very difficult. We will get down to a level of control, but eliminating it is going to be extremely difficult. And Dr. Fauci and myself would each hypothesize that because it's more infectious than flu, and flu is endemic. Now, we have new tools. We're bringing to bear genetic sequencing on a daily basis on this. We have a vaccine technology in the Pfizer and Moderna mRNA vaccines that can be easily adaptable. So you always want to strive to elimination, and we may be able to achieve that. But based on what we're seeing biologically with this virus, the prediction of it being endemic is a reasonable one.
Thank you.
Any other questions for Dr. Pandori, Heather Kerwin, or James English? Okay. Thank you to our guests for being on today. Like I said in the chat, this media briefing was recorded and it'll be on our website here in the next 20 to 30 minutes or so. If you have any further questions, feel free to reach out. And thanks again for Dr. Pandori, Heather Kerwin, and James English for being on. Thank you.
Thanks.